if you're having digestive issues that are inconsistent, I would encourage you to consider histamine as a driver. So let me explain. So histamine is something that our bodies naturally manage every day. And some of us can manage it a little bit better genetically than others. And depending on your health, depends on how well even your good genetics are working. So let me explain. So some of the things that can be the root or the source of a histamine intolerance can be just your nutritional state. So deficiencies or your food choices or allergies that you already have, those can contribute to your histamine response. Also your gut health. So like a small intestinal bacterial overgrowth is going to have the ability to give you a histamine intolerance. Also your environment. So certain things in the environment can trigger a histamine response. And then medical conditions and medications, and then of course your genetics. So all of those fill our bucket every day. And if that overflows, then that's when it's problematic for anyone. So what are the symptoms if you're having a histamine reaction? And usually it can happen pretty quickly for a lot of people. So, but again, you got to go back to the genetics and kind of that whole reason of why you're having the reaction to really know how quickly you're going to respond. But histamine can happen from 0 to 15 minutes of consuming the food, or 15 to 30 minutes of having some type of histamine type food or releasing food, either one. So you're going to have like bloating, stomach pain, heart palpitations pretty rapidly. And then as the time progresses, you might notice some headaches, you might have some lightheadedness, some fatigue, maybe even flushing, like your skin gets really red, maybe even some hives or diarrhea. So again, those can happen all within 15, 30 minutes of consuming a food, if your bucket is already overflowing. So that's where it kind of goes back to the dose dependence. So every day we're filling up our histamine bucket with stress and foods and toxins and reactions, and then it just kind of starts over again each day. So if that bucket is raising every day and it's not coming back down, then that's when you overflow and you have the inability to manage that. So how that looks when you have histamine type foods, the foods that are naturally high in histamine, think of aged and fermented. So alcohol is fermented, kombucha, even the healthy sauerkrauts, kimchi, those are also good for you, except when they're not. And that's when histamine is an issue, is when they're not. So think of fermented things. So even yogurt is fermented. And then you also think about vinegar and mustard, dried meats, bacon, deli meats, anything that's been smoked, or even like jerky, salamis, those types of things. So those are the foods that are just naturally high in histamine. And if your bucket is overflowing and you have some salami and some aged cheese, guess what? You might have some stomach pain or some bloating or heart palpitations, or you might have a headache later in the day because you had those and you did not have the ability to process that excess histamine that you threw on top of the bucket that made it overflow. So when it comes to those histamine foods that increase the release of them, these are things that you probably consume pretty frequently. So avocados, tomatoes, spinach, olives, mushrooms, bananas, dried fruits, any type of citrus stuff, lime, lemon. So that can even be like a lime juice that you're marinating your chicken in, or you're adding lemon wedges to your water. It can be strawberries and raspberries, cherries. All great healthy things, but they can actually increase the histamine release. Even things like nuts, like walnuts, sunflower seeds, cashews, and then even like the canned meats, like tuna and sardine, and those types of canned fish, are also going to be increasing the release of histamine. And then even like green tea and chocolate, those also can do the same thing. So again, lots of things to consider, because it may not be that you had, pickles, but you had some olives. So you didn't actually have a food that was high in histamine, but you had the olives that will increase the release of histamine. So, and again, like I said, it goes dose dependent. And there is a genetic base to this. So some of us have the ability to consume more at unlimited amounts, because our body produces enough of this diamine oxidase, that DAO, that we are capable of kind of capturing that excess histamine and being able to prevent it from taking over and controlling or making us feel bad. So it's important to realize that if you are struggling with bloating and stomach pain and it seems to be inconsistent, histamine could be at the root of it, or just the foods that increase the release of histamine. So when you struggle with digestive issues, kind of getting to the root cause of it is a key thing that you really have to consider, because there's so many drivers that could be contributing. And like histamine, it's something that maybe you didn't have much histamine producing foods or histamine releasing foods the 24 hours prior. So that morning when you had spinach and your eggs with some salsa on top, it didn't bother you. But then you continued throughout the day and had some olives and maybe some salami and some other histamine foods. And so the third day is when you're going to feel a reaction to spinach and eggs. I think the most important question you have to ask yourself is why? Why am I now noticing these symptoms? Why am I having bloating and gas and diarrhea and flushing and all those histamine type symptoms all of a sudden? When it comes to bariatric patients, the one driver that would be at the top of my list is SIBO, small intestinal bacterial overgrowth. This is something that can occur in 40 to 80% of the cases. So if you are presenting with digestive issues like we're discussing, that's why you have to, one, identify and figure out, am I really reacting to these foods? And if so, dig deeper. You need to dig deeper and decide, hey, is this bacterial overgrowth? Is this why I'm having these histamine reactions? Because when it comes to SIBO, those bacteria produce more histamine. So that may be the only thing that clues you into, hey, I might have bacterial overgrowth. So I would encourage you, if you are a bariatric patient, doesn't matter which surgery you've had, you're having these types of digestive issues, and also the skin, and just the other issues that we discussed for histamine, the kind of the red flags for histamine, that's where I would consider bacterial overgrowth as the driver, and that being the root cause of why you actually have a histamine reaction. So if you think of a bucket, and as it kind of, the doses increase and you have more of it, and if you don't have that DAO that can keep that level in the bucket lower, if the bacteria kind of take over the DAO and they don't allow them to kind of do their job, then guess what? You're going to overflow your bucket of histamine, and now you feel miserable maybe all the time. So I think if you are struggling with digestive issues, really working with a provider who can help identify the root cause. So do you have bacterial overgrowth that's really contributing to this histamine issue? That is a key thing to consider. So if you are struggling with digestive issues inconsistently, then I would encourage you to work with a registered dietitian who is skilled in histamine intolerance and can help you work through a process so that you feel better.